Now, Kenya abolished delivery fees in all public health facilities through a presidential directive on June 1st, 2013, with an aim of promoting health delivery services and reducing pregnancy-related mortality in the country. Although access to maternal health care has improved, many women say more needs to be done to address postnatal complications. Nimrod Tabu reports.
Although there have been improvements in the recent past, the status of maternal health care in the country has still not met the required international standards. Maternal mortality in rural Kenya is still very high, and many experts attribute high rates of maternal mortality in rural Kenya to lack of access to quality care and skilled birth attendants, the high burden of HIV/AIDS, and an unmet need for family planning. Though nearly 90% of women in rural Kenya seek antenatal care, many wait until the second or third trimester, limiting their benefits. Additionally, a majority of women in rural Kenya give birth outside of health facilities, oftentimes without the care of a skilled birth attendant. But things appear to be different in urban centers. Nairobi's Mathare area. Hundreds of women visit this health center on a daily basis. They are here for their routine checks after the national government as well as the county government made maternal health care accessible and affordable to millions of pregnant women. However, many who come here are not free from complications that result from pregnancy. New mothers and their infants also come here. Lois Wanjeri gave birth to a bouncing baby boy 13 months ago, but several months later, her son's development started to slow down.
Akiwa na 8 months. So after kumzaa nikamlea visuku, alimzaa akiwa na 2.4. But akaanza kugonjeka.
Ramzi's lack of growth is a reason for concern.
Kumpea chakula, cereals na hizo madengu, matunda, na pia hizo uji za tunapoa usi. Sioni akiongezea kilo venye anafaa.
She is here to find out why, but first things first. Ramzi has to be weighed.
5.5.
The nurses are shocked by the child's lack of growth. Malnutrition is not the cause of Ramzi's weak body mass.
Kulingana na ile situation yenye mtoto wangu wa firstborn aliyashaipitia, but huyu ako at least he's good. Because huyu alikuwa na pneumonia na rickets, akiwa na 8 months alikuwa ameshikilia shingo, but huyu akiwa na miezi 2 already alikuwa ameshikilia shingo na alikuwa amestimawa.
On this day, the Mathare Healthcare was playing host to Princess Sarah Zeid of Jordan. She is here courtesy of the United Nations. Her Royal Highness Princess Sarah Zeid is a special advisor to the World Food Programme on maternal and child health and nutrition. She is also the chair of the Newborn Health in Humanitarian Settings Initiative. She is here to visit the mothers and witness for herself the benefits of maternal health care in the slums. According to Her Royal Highness Princess Zeid, Kenya, like many other developing nations, must prioritize specific needs.
One of the critical points about nutrition is that it is the foundation of all things, and those first 1,000 days are so critical from the time that a child is conceived until their second birthday.
Preventable maternal and newborn mortality and morbidity are highest in fragile and humanitarian settings, and this must stop, she says.
It happens at every level, from government leadership through to the community level. The support that the international community is able to bring. At the end of the day, it is the trust that a woman has that she will receive quality, respectful care.
All the women she met today inside this room had issues that were as a result of complications during pregnancy and even after. And Her Royal Highness is not new to such complications. Princess Zeid, who is married to a Jordanian prince, nearly lost her life in the year 2000 while giving birth to her child. She suffered a condition called amniotic fluid embolism and had little chance of survival. Since then, she has championed matters of maternal health care across the world.
Had I died, I would have left behind an 8-year-old boy, a 6-year-old girl, and a newborn baby.
In Kenya, access to healthcare facilities and care is still limited in cities. In some cases, health facilities are few and far between, and the referral systems are weak. For instance, if you remove Nairobi from the numerator, the number of skilled physicians per population is very minimal. While many women in urban cities such as Nairobi can access maternal health care, a lot more still needs to be done.
Wherever you are, it's access to information, it's access to nutrition, it's access to quality services, and this is what is needed everywhere.
It has been said that by the year 2025, there will be 25% more people in Kenya. And what that means is, when planning is being done, policy makers must think about the scale of solutions for efficient and accessible healthcare for mother and child. Currently in Kenya, out of 100,000 births, 362 result in maternal deaths, while the number of stillbirths stands at 23 for every 1,000 births. Wanjeri, like many other mothers here, is now hoping that experts will help her eradicate the postnatal issues affecting her young one, once and for all. Nimrotabu, Citizen TV.